In some cases, children are seen to suffer from this disease, as are men and the elderly. But the predominant age group is young women. How common is chronic fatigue? Various figures have been suggested. Some actually of these figures suggest that 100,000 patients in the United States suffer from the condition. In a research study in Belgium, Kenny de Vandermeer, suggests that a particular protein 2,5A, is seen as a diagnostic entity in chronic fatigue. Research into this particular diagnostic entity is still underway. The peculiarity of the symptomatology coming and going suggests that there is a periodicity, that the cycle of the condition can actually wax and wane. Some days the patient actually feels better than others, and this seemingly is seen as the condition progresses even under treatment. Nancy Klimas in Florida has suggested actually that there is an abnormal Th2 immune response, and suggests that this is an indicator of a dysfunction in the immune system. Others actually have elicited an effect on the blood pressure, and this is called neurally mediated hypotension, NMH. This particular condition is diagnosed by a tilt table test. The suggestion is that the body is unable to control the blood pressure when the posture changes. The explanation of this particular phenomenon is not well understood, but some have suggested that the hypothalamus, or the hypothalamic pituitary adrenal axis, is interfered with. This has not been well defined. Other problems are seen, such as a condition called brain fog. This is an expression conjured by some patients to define the feeling of being unable to concentrate, but being unable to define exactly what they were reading. They can actually read a book and not actually be able to remember the previous page, be on a telephone and not actually remember the thread of the conversation, be in a car on a freeway and not remember exactly where they're driving to. This actually can be quite confusing. How do we treat this disease? There is no uniform method of treatment. The method of treatment that we use in our practice is to actually try to shift the immune system, because we believe, as do others, that this is an immune system dysfunction. Shift the immune system back towards normal. The method of approach that we use was defined about 12 to 15 years ago in Texas by some clever research workers who found a substance called cutepressine that was used decades previously for the treatment of herpes zoster, which causes shingles and chickenpox, And this immune system reactant was thought to be possibly helpful in other herpes conditions. And as 3 of the viruses that are investigated by certain experimental workers were Epstein-Barr, that is a herpes virus, cytomegalo-inclusion virus, another herpes virus, and obviously human herpes virus 6 is a herpes virus. So these 3 herpes viruses were thought to maybe be affected or changed by the Q-depressin injection. The research workers in Texas got a response of approximately 30%. 30% of patients actually reacted positively to the Q-depressin. This was not actually a great result, and a lot of doctors wanted to give more just a passing acknowledgement to this particular treatment. And as 30% was not, in their opinion, satisfactory, the Q-depressin was not widely accepted.